What's going on, guys? Josh Throne here with MD Hair Labs, and today I get to do something really fun. We had a patient who came in a little over 6 months since his hair transplant, and he was excited, and he came in and shared his results with the team. So we have some photos, and I'm going to walk you through what the game plan was, and you'll get to see the outcome as well. So here he is. When he came into us, this is what he was dealing with. He had some hair loss in the back that we were dealing with. He had miniaturized follicles throughout the mid scalp that we were dealing with. And he also had hairline loss that we were dealing with. And so I love this about our clinic. I love this about our leadership and the way that we go about treating patients is that the first thing that I think everybody should be focused on here is how do we stop the problem from getting worse? See, because there's hair still on his head and we need to save that and we need to try to get that back into good health. Otherwise, what's the point of a hair transplant if we're, putting some hair here or there just to lose some hair elsewhere? And so we genetic tested him, and that genetic test is powerful because it gives us a lot of insight on how to best treat him, some predispositions that he might be dealing with genetically, but then really give us some insight on what's going to work best for him treatment-wise. So no more guessing. We can really try to pinpoint exactly how to revive a lot of the hair that's weakened. But at this point in time, late 40s, early 50s, he's already lost enough that it's still going to require a hair transplant. So we wanted to focus our hair transplant first on the front hairline, working back to the mid scalp. And then again, if we can get additional grafts, we're going to get those and work on restoring that crown as well. And so here's what I'm excited about, because now that you know the plan, take a look at the results. This is why he was celebrating. And this is what I love to see. And when it's done the right way, this is what people can obtain. Now, obviously, it's all based on how much current hair you have, your donor area, your goals, etc. But in his case, he was perfect for this because he still had a lot of follicles that we could revive and we could get back into good health with our genetic testing and our leadership, putting together a great medical management plan for him. And then with the hair transplant, rebounding and reinforcing the hairline in a way that looks very natural on him, and then still having enough donor hair to make sure that we could thicken up that crown as well. Now, not everybody has all these options. Sometimes people have to sacrifice the crown due to donor hair supply or just overall hair loss. And so everything's a little bit nuanced. So this plan might not be the exact plan for you, but if you want to know what the plan is for you, go to mdhairlabs.com. And you can learn more about what we do. You could schedule a free consultation about a hair transplant, and you can meet with our team here at MD Hair Labs. We are so excited for our patient. So thank you for watching this video. If you have any questions, drop them in the comments, and we look forward to seeing you here, mdhairlabs.com.